Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. A female patient with a terminal illness is in denial. Indicators of denial include: Option A, shock dismay. Option B, numbness. Option C, stoicism. Option D, preparatory grief. Right answer is Option A, shock dismay. Shock and dismay are early signs of denial, the first stage of grief. The other options are associated with depression, a later stage of grief. The nurse in charge is transferring a patient from the bed to a chair. Which action does the nurse take during this patient transfer? Option A, position the head of the bed flat. Option B, helps the patient dangle the legs. Option C, stands behind the patient. Option D, places the chair facing away from the bed. Right answer is Option B, helps the patient dangle the legs. After placing the patient in high Fowler's position and moving the patient to the side of the bed, the nurse helps the patient sit on the edge of the bed and dangle the legs. The nurse then faces the patient and places the chair next to and facing the head of the bed. A female patient who speaks a little English has emergency gallbladder surgery. During discharge preparation, which nursing action would best help this patient understand wound care instruction? Option A, asking frequently if the patient understands the instruction. Option B, asking an interpreter to replay the instructions to the patient. Option C, writing out the instructions and having a family member read them to the patient. Option D, demonstrating the procedure and having the patient return the demonstration. Right answer is Option D, demonstrating the procedure and having the patient return the demonstration. Demonstrating by the nurse with a return demonstration by the patient ensures that the patient can perform wound care correctly. Patients may claim to understand discharge instruction when they do not. An interpreter or family member may communicate verbal or written instructions inaccurately. Before administering the evening dose of a prescribed medication, the nurse on the evening shift finds an unlabeled, filled syringe in the patient's medication drawer. What should the nurse in charge do? Option A, discard the syringe to avoid a medication error. Option B, obtain a label for the syringe from the pharmacy. Option C, use the syringe because it looks like it contains the same medication the nurse was prepared to give. Option D, call the day nurse to verify the contents of the syringe. Right answer is Option A, discard the syringe to avoid a medication error. As a safety precaution, the nurse should discard an unlabeled syringe that contains medication. The other options are considered unsafe because they promote error. When administering drug therapy to a male geriatric patient, the nurse must stay especially alert for adverse effects. Which factor makes geriatric patients to adverse drug effects? Option A, faster drug clearance. Option B, aging-related physiological changes. Option C, increased amount of neurons. Option D, enhanced blood flow to the GI tract. Right answer is Option B, aging-related physiological changes. Aging-related physiological changes account for the increased frequency of adverse drug reactions in geriatric patients. Renal and hepatic changes cause drugs to clear more slowly in these patients. With increasing age, neurons are lost and blood flow to the GI tract decreases. A female patient is being discharged after cataract surgery. After providing medication teaching, the nurse asks the patient to repeat the instructions. The nurse is performing which professional role? Option A, manager. Option B, educator. Option C, caregiver. Option D, patient advocate. Right answer is Option B, educator. When teaching a patient about medications before discharge, the nurse is acting as an educator. The nurse acts as a manager when performing such activities as scheduling and making patient care assignments. The nurse performs the caregiving role when providing direct care, including bathing patients and administering medications and prescribed treatments. The nurse acts as a patient advocate when making the patient's wishes known to the doctor. A female patient exhibits signs of heightened anxiety. Which response by the nurse is most likely to reduce the patient's anxiety? Option A. Everything will be fine. Don't worry. Option B. Read this manual and then ask me any questions you may have. Option C. Why don't you listen to the radio? Option D. Let's talk about what's bothering you. Right answer is Option D. Let's talk about what's bothering you. Anxiety may result from feeling of helplessness, isolation, or insecurity. This response helps reduce anxiety by encouraging the patient to express feelings. The nurse should be supportive and develop goals together with the patient to give the patient some control over an anxiety-inducing situation. Because the other options ignore the patient's feeling and block communication, they would not reduce anxiety. A scrub nurse in the operating room has which responsibility? Option A. Positioning the patient. Option B. Assisting with gowning and gloving. Option C. Handling surgical instruments to the surgeon. Option D. Applying surgical drapes. Right answer is Option C. Handling surgical instruments to the surgeon. The scrub nurse assists the surgeon by providing appropriate surgical instruments and supplies, maintaining strict surgical asepsis and, with the circulating nurse, accounting for all gauze, sponges, needles, and instruments. The circulating nurse assists the surgeon and scrub nurse, positions the patient, applies appropriate equipment and surgical drapes, assists with the gowning and gloving, and provides the surgeon and scrub nurse with supplies. A patient is in the bathroom when the nurse enters to give a prescribed medication. What should the nurse in charge do? Option A. Leave the medication at the patient's bedside. Option B. Tell the patient to be sure to take the medication, and then leave it at the bedside. Option C. Return shortly to the patient's room and remain there until the patient takes the medication. Option D. Wait for the patient to return to bed, and then leave the medication at the bedside. Right answer is Option C. Return shortly to the patient's room and remain there until the patient takes the medication. The nurse should return shortly to the patient's room and remain there until the patient takes the medication to verify that it was taken as directed. The nurse should never leave medication at the patient's bedside unless specifically requested to do so. The physician orders heparin, 7,500 units, to be administered subcutaneously every 6 hours. The vial reads 10,000 units per milliliter. The nurse should anticipate giving how much heparin for each dose. Option A. 1/4 of a milliliter. Option B. Half a milliliter. Option C. 3/4 of a milliliter. Option D. 1 1/4 milliliter. Right answer is Option C. 3/4 of a milliliter. The nurse solves the problem as follows. 10,000 units, 7,500 units equals 1 milliliter, x 10,000 x equals 7,500 x equals 7,500, 10,000 or 3/4 of a milliliter. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.